Welcome to the latest edition of Hematology Updates, covering breakthroughs in the past 2 weeks, brought to you by Lucid Quest. Iaso Bio and Instituto Butantan signed a licensing agreement to develop a CAR-T therapy locally in Brazil for hematological cancer. The partners said local development and manufacturing could lower costs and expand future access through the public health system. ASH and ISTH published new clinical practice guidelines on anticoagulant prophylaxis for non-cardiac pediatric patients at risk of venous thromboembolism. The guidance includes conditional recommendations against routine prophylaxis in some groups and in favor in selected higher-risk populations. A retrospective single-center study in children with severe hemophilia A with inhibitors found that Hemlibra was associated with better bleeding control, improved quality of life, and lower medication cost than immune tolerance induction. The findings may influence treatment choice pending broader validation. Pharmac announced that venetoclax plus ibrutinib and venetoclax plus obinutuzumab will become funded first-line options for CLL in New Zealand from May 1, 2026, alongside broader second-line access to ibrutinib. The move shifts targeted combinations earlier in the treatment pathway. OPN Bio received FDA Fast Track designation for OPN-6602, an oral dual EP300 and CBP inhibitor in Phase 1 for relapsed or refractory multiple myeloma after at least 4 prior lines of therapy. The designation signals continued momentum in late-line myeloma development. Eli Lilly reported positive top-line Phase 3 results from Bruin's CLL 322 in previously treated CLL or SLL. The trial met its primary endpoint, with statistically significant and clinically meaningful progression-free survival improvement for pirtobrutinib plus venetoclax and rituximab versus venetoclax and rituximab. Natera highlighted a positive interim futility analysis from Allogene's ALPHA3 trial in first-line consolidation large B-cell lymphoma. The update included MRD clearance in treated MRD-positive patients and favorable circulating tumor DNA dynamics versus observation. Ferrin announced positive Phase 2 results from Bexmab in higher-risk myelodysplastic syndrome. The company said the study met its primary endpoint in treatment-resistant patients and that bexmarilimab plus azacitidine remained well-tolerated. Stay ahead in hematology research. Like, share, and subscribe for our updates. Visit www.lqventures.com or email us at info@lqventures.com.